So Stacy, you talked about the continuum of care and the fact that this is one of the fundamental shifts that's happening in healthcare. How does Covidien see it? How do you implement that concept within the business?
Well, while I certainly can't speak for Covidien broadly, in our vascular business, what we really mean by that is measuring the productivity of our technologies, not simply in the procedure, but the complete care of that patient over time and preserving treatment options for the future. So as an example, we have a technology that's called the TurboHawk, and what that does is it actually removes the plaque from the vessel without leaving an implant behind. And what that has the benefit of doing is ensuring that if the patient needs to be retreated, that the physician is not going through an implant, which can be very difficult to treat at that point. That's one example. A second example would be in opening up the distal vasculature in the lower limb, doing that versus preventing amputation. As an example, amputation is fast, it's inexpensive, and it still happens in this country today. Whereas if you open that vessel and you allow the patient to preserve their limb, not only are they leading a better quality of life, but most importantly, I think, is that is a lower cost of care for that patient over time. And I think it's incumbent upon industry to be able to do the studies and to be able to demonstrate those examples so that we can move away from simply the intra-procedural treatment cost to the actual care of the disease state over time.